There are three kinds of cells circulating in our blood: white blood cells, red blood cells, and platelets. White blood cells are components of our immune system. In a way, we can consider them as soldiers, part of a complex army. Red blood cells are the most numerous cells you can find in the blood. They are the equivalent of truck drivers transporting oxygen very quickly and at a long distance to every organ and every system throughout our body. The third category of cells are small fragments we call platelets. They are in charge of forming clumps to prevent bleeding when there is a damage to blood vessel like a small cut. You can think of them just like plumbers fixing leakages throughout the blood system. Now, these three categories of cells are incredibly different by the way they look and by the way they function. Despite that, they all derive from the same cell. That original cell is called stem cell. We also use the term hematopoietic stem cell to say that this is a cell that will eventually become a blood cell. We can consider those stem cells as baby cells, immature cells early in their life who have not yet moved into a committed path of maturation. Stem cells live in a niche inside the bone marrow, just like a daycare. There they are protected and cared for by large nursing cells. Stem cells are very precious and are the equivalent of infants. They don't look yet like anything they haven't decided yet to become. You cannot tell what they are going to become or how productive they are going to be in society, because they are just small, few, and precious. Now, stem cells have a characteristic. Throughout our whole life, they will keep making copies of themselves. And then eventually, when they decide what to become, platelets, red cells, or white blood cells, they will go ahead in a process that we call differentiation, or growth, or education. We are going to focus on the stem cells that become white blood cells. We discussed that the white blood cells are those army type of cells. They constitute our security systems, our defense against enemies such as viruses, bacteria, fungi. There are different kinds of immune cells. Just like we have different kinds of fighters, Army, Marines, Navy. Among the most common white blood cells we have neutrophils, considered to be our first-line soldiers, and lymphocytes. Lymphocytes are very complex cells, capable to build a complex and durable response to enemies. Lymphocytes are specialized, and we know that they require advanced training and education. Lymphocytes are like component of a SWAT team. They have to go through an extensive amount of training to hone a specific skill. To become any of these immune cells, a stem cell literally goes to a path of education, leading to change shape and function to become a committed, mature white blood cells. We say that stem cell differentiates. The stem cell has to decide to become something and then go through the motion of growing. It is the equivalent of a child that goes through elementary school, where he's growing, but he still cannot do anything. Then he goes through middle school and high school, where the cell starts shaping and acquiring skills, preferences, and functions. Eventually, the cell has to get a diploma, has to go through a landmark of maturation to put the cell finally in the condition of doing the job she committed to. Throughout this long process, from baby to mature white blood cells, there can be, as we say, escapes. This is a phenomenon in which, the earlier into the later stage of differentiation, the cell can deviate from her normal destiny and become crazy. This craziness is because there has been a damage into the stem cells. When I say that, in particular, we are talking about a damage into the DNA of the stem cell. This damage to the DNA is the equivalent of a mistake in the instruction booklet for the cell growth. These mistakes normally are corrected naturally, and the damaged cells normally are discarded, but at times some of these mistakes are carried over. A term for these DNA mistakes or damages is mutation. Now, a mutated cell can accumulate abnormalities in its structures and might get stuck on an early or intermediate step of the cell evolution. We call that a block in differentiation. This abnormal cell may start making lots of copies of themselves without growing through the rest of the maturation. Eventually, they also lose their function, and they will lose the trajectory of their normal life that ends eventually in their natural death. Instead, these cells will keep surviving and multiplicating at the expense of all other cells in the bone marrow, and also other cells in the lymph node and throughout the body. This is ultimately the characteristic of a blood cancer cell. These cells will continue behaving badly, growing numbers, spreading, following just a different agenda against the rest of the body. They will grow, they will use nutrients, and interact with surrounding cells like bullies. They will not care about anybody or anything. Ultimately, they will overwhelm the remainder of normal stem cell and all other blood cells going through normal pathway of growth and education. This phenomenon of escape, craziness, can happen at different stages of maturation of the cells, and this would eventually identify what type of leukemia it is. Leukemia is a word that comes from Greek, leukos, white, and heme, blood, to originally indicate a disease with an excess of abnormal white blood cells in the blood and in the bone marrow. In leukemia, the cancer cell can be seen floating in the blood. While we can have leukemia cells deriving from a wide array of blood cells, when the leukemic cells have a very immature, undifferentiated appearance, we refer to them as blasts. We think about leukemia as a form of liquid cancer because the cancer cells are literally invading the circulating blood. That said, leukemic cells are often found crowding other sides of the body, such as the bone marrow, the lymph node, and at times they accumulate in lumps or masses, or inside or close to other tissues or organs in the body. In general, we tend to divide the leukemia into classes, the acute and the chronic. Acute is a term that we use in medicine to explain a condition that hurts you quickly. A heart attack is an acute phenomenon. You need help just right then. If you don't get help quickly, then it can kill you fast. Acute makes you sick fast. Chronic is a condition that one has, and many times the person having it doesn't even know that he has it, and this may be there for many months or many years. When you diagnose it, you don't have to necessarily treat it immediately, but you may have some time to think about it. The acute leukemia is leukemia that happens in early maturation of the stem cell generally, but there can be exception. Sometimes also mature cell leukemia can behave as acute leukemia as well. In chronic leukemia, we can also introduce another separation between acute leukemia that are myeloid or acute leukemia that are lymphoblastic. Myeloid means that they come from the class of the neutrophils, or cells similar to neutrophils. So, you remember, before we talk about the neutrophils and the lymphocyte, right? So, if you come from the neutrophils, the most discussed leukemia is going to be an acute myeloid leukemia. If it's chronic, we will call it chronic myeloid leukemia. Now, the next possibility for acute leukemia may be one that comes from lymphocytes, those highly educated SWOT-like cells. You can call those acute lymphoblastic leukemia, or also you can call them, if chronic lymphocytic leukemia. What do we do about it? A first way to knock down the blast or the leukemia cells is to use chemotherapy. Chemotherapy is the oldest way to treat these diseases. We have been using chemotherapy for about 70 years. Of course, this is a liquid disease. It is all over the body. Wherever the blood is, the disease is there. This is why we don't use surgery, we don't use only radiation, because the disease is liquid all over the body. Chemotherapy, typically, is being given through an IV, goes through the bloodstream, and goes all over the place. Chemotherapy is per se toxic because it's a medication or a combination of medication that kill human cells, with the goal of killing those transformed, crazy cells. The pro of chemotherapy has been used for very long, so there is a lot of experience using it, and also it can reduce the amount of blast, the amount of leukemia, very quickly. As we say, it can reduce quickly the tumor burden. If I have an acute leukemia, I need to reduce the number of the bad cells because they are damaging my body, and the chemo can squeeze their number very rapidly. Problem, of course, is the toxicity. The toxicity of chemotherapy includes fatigue, nausea, need for transfusion, potential for infection. Still, despite all these issues and toxicity, the chemo remains a mainstay of treatment. The second important mainstay of treatment for leukemia is what we call targeted therapy. Targeted therapy is a very smart way to kill the blast. We know that there are certain mutations that drive the cell crazy, and we can selectively go and stop those crazy cells. So we have medication that will target only those cells that carry those specific mutations, those specific DNA damages. The target, in many ways, is just like a keyhole. So the targeted agent is nothing but like the key that just is going to fit inside the cell that carry that keyhole, that mutation. The targeted therapy has the advantage that it is designed to kill just the bad cells and only the cells that carry the target. So the targeted therapy is in many ways more personalized, is tailored on the person and the type of disease. Before using a targeted therapy, we have to have a deep knowledge of the mutation of the cells of the leukemia of the person, so we know whether we can use a specific targeted therapy or another. The cons about targeted therapy is that it's not always possible to use it because, in many cases, we don't have a target that we can aim at in leukemia in all patients. There is a third treatment for leukemia we call immunotherapy. So to put them together, chemotherapy, targeted therapy, and immunotherapy. Immunotherapy is a type of treatment where we use an immune system or an immune recognition to kill the bad cells. The blast, the leukemia cells, look abnormal to an immune system because they carry abnormal substances on their surface. Let's say that these cells have a piercing, right? So you can tell who has it and who does not. An immune cell have the capacity to recognize the cells that have this abnormality, and those immune cells are also able to kill them through this immune recognition. Sure, the immunotherapy is complicated, and there are many forms of immunotherapy. One can use, for example, an antibody, or, as they say, an antibody drug, which is basically an antibody made in a factory that will just stick to the cancer cell when you infuse it into the vein. Then, after the antibody sticks to the blast, it will cause the immune system of the patient to kill the cell that have the antibody attached to it. Sometimes we use other strategies. For example, we have antibodies that are attached to a chemo drugs. It is like a key for a locker, and there is a keychain attached to this key, and this keychain is a toxic chemotherapy. So basically, you will have an antibody that will attack to the leukemia cells and eventually will poison the leukemia cells because it carries a chemotherapy. So this is a way to deliver the chemo in an immune way, in a way more smart fashion. Ultimately, there is another kind of immunotherapy which uses cells, in particular immune cells, and cells that are able to recognize the leukemia cells and kill them. We call this type of treatment immune effector cell therapy. With these immune effector cells, we use a different immune system to go find, search, and destroy the blast. A form of immune therapy that has been the most successfully historically in curing leukemia is what we call allogeneic stem cell transplant, or also bone marrow transplant. A bone marrow transplant means that I can use the immune system or immune cells from a donor so that those cells donated by the donor will kill the leukemia cells in the recipient. This therapy can destroy the disease completely and they can cure it. Differently than the chemo, it doesn't work if there is too much disease burden. So the chemo is good to reduce the burden when the burden of disease is very high, but eventually may not be able to destroy all the disease and to cure it. Well, the transplant can do that. The transplant can take care of the rest of the cells not killed by chemotherapy and can get rid of them for good. So, while chemotherapy and even targeted therapy can be very powerful, they may not be able to cure certain leukemias. The transplant, as form of an immunotherapy, can indeed cure most of leukemia. The cons of transplant is that, of course, this type of treatment is complicated, can be lengthy, and can also have its own risk and toxicities. Leukemia is a general term for many forms of blood cancer. They will have different behavior and they will require different treatment. We know that the best way to come out from a leukemia situation is to be, from the get-go, seen in a leukemia specialized center and be seen by leukemia specialists. That would allow, on one end, to complete the diagnosis and to get as much information as possible on the nature of the enemy, and then to have as much as possible a place where there is a large range of options for treatment and a deep experience for each of these options.